Hello, I'm Ken Bremner, Chief Executive of South Tyneside and Sunderland NHS Foundation Trusts. The purpose of this short film is to highlight the importance of carers and partners in working in the care that we provide to patients here in South Tyneside and in Sunderland. And across both the foundation trusts, we do recognise the value and the importance of carers who provide very valuable support and care to families 24/7. And family members and friends cannot manage without the help of their carers. Now, the caring role does not just stop when people use our services. Carers continue to provide a very vital source of support, information and advice. And we remain strongly committed to supporting and working in partnership with carers whilst the patients access our services in both hospital and in the community. And that helps us ensure they get the very highest quality and most effective care wherever possible. Now, to further develop our work around carers, we've listened, and their stories have inspired the development of this particular film. And I'd like to thank in particular the family of Mrs. Defty, who inspired this film, but also the South Tyneside young carers for their contribution too. And as you watch this film, I'm going to ask you to think about the things that you can do in your own particular role to ensure that carers are welcomed and valued for their contribution.
So first impressions of walking onto the ward, everybody was anxious. We didn't know what was going on with Mum. We knew she was poorly, but we didn't know how poorly she was. But it was difficult for us walking onto the ward and having to try and hunt staff down.
Look for them.
Look for staff. We didn't at that time know who our named nurse was, because there wasn't anything above the bed to say who the named nurse was.
And I think the feeling you get, the staff's very busy, you know, and it's just like trying to find somebody, and when it's a stressful situation, I think somebody should be coming and looking for the signs of like relatives wanting to know information. Her meals, she struggled eating, she had a fractured wrist on one hand, and the other hand she was unable to use, the wrist had been fused, and just like eating, there was nobody to help her eat, and often the nurses would come and just take the plate away. It was still full, and there was no questions asked.
And at sort of that stage I recognised Mum wasn't eating, so I asked one of the qualified nurses if they could put our Mum onto a food and fluid chart, just to get an idea of, you know, what exactly is she eating, what is she drinking. You know,
so it's just a worry, isn't it, when, especially when you've looked after and you've made sure she's had a hot meal every day, you know, snack, plenty of drinks, even down to the cups. Are they able to pick the cup up themselves? Is it within easy reach? And it's just things that didn't happen. There was one day I visited and my mum had like bandages on her legs, and I knew they were pressure bandages, and they weren't very nice. They weren't sort of put on right, the way like the district nurses had done in the community. So at that time, after visiting again, I had to rely on my sister, and I said, you know, my mum's bandages are not looking very nice, you know, so then that meant my sister had to come back over to the hospital to have a look, and I think at that point
I had a little look and they weren't put on correctly. The way they were put on could have caused damage. So I did go to the nurse and asked if somebody could put the compression bandaging back on her leg, and I was told nobody on that shift was trained to do it. And that if I wanted it done, would have to go to a tissue viability nurse who would have to come onto the ward and redo the bandaging, but at that stage it may take 3 to 4 days for that to get put in place. So at that time the aim was to make sure Mum was as comfortable as possible, and I just said to them, you know, if you supply the bandages, I'm qualified in putting the compression on, I'll put it on myself, because I wasn't prepared. And I didn't want my mum actually to wait another 3 or 4 days to actually get the correct bandaging put back on her leg.
It just caused more distress
Yeah.
and discomfort, and just it wouldn't have been nice to have like had to witness that. And I think you done the best it was the best outcome at
Yeah,
that time,
it
which
was-
wasn't ideal. So looking back, it would have been nice if they'd only just getting to know me mum a little bit better, finding out what she liked, what she didn't like. You know, it's important, I think, because it helps you to understand that person a little bit better, what the interests are, just to build up that little bit of conversation when the nurses are coming onto the ward. I think getting to know that person makes it more personal, and it's just more about the person-centred care, which would make a huge difference on the wards.
I mean, an example is Mum loved to shower, didn't she? Like, and we used to take it in turns to shower Mum at home. But when she was on the ward, unfortunately,
It was 4 weeks, still no offer of a shower, and it was just an offer of a bath, which my mum just totally didn't like. A bath, it was always a shower. And I think having something like that included in the care plan, the nurse would have then read.
Mary loves a shower rather than never had a bath for years. She always liked her showers. So just things like that, isn't it? What would be a nicer touch?
So to ensure that we learn from the experience and the examples that we've shown in this particular film, we've developed, in partnerships with carers, this charter to support the delivery of our commitment to recognise, value and involve carers as expert partners in all our patient care. And we're going to endeavour to raise awareness amongst our staff members and hope that this film will be instrumental in helping us to achieve that. And again, I'd like to take this opportunity of thanking in particular the family of Mrs Defty and South Tyneside Young Carers for their own personal contributions. So thank you for listening, and thank you for all you do for our patients, for their families and their carers.